Hi everybody, it's Positive Bluebird and
Pablo.
so we're doing a hidden vlog today, which means that I am not on camera because I only have about 4 teeth left. And I don't think you guys want to see, missing teeth and gums and, what looks infected even though it's not infected. So, yeah. But as you guys know, I have been on a major dental journey for the last year. And it is from the Dental School of Medicine in Aurora. And I'm actually seeing a professional dentist who got her degree instead of the students because the students would take even longer. So, through Medicaid, the goal is to finish up by June. It was supposed to be last December, but as you all remember, I was in the hospital for a couple of weeks, and then I had started dialysis. And so things, and plus the students also had a month-long break during the holidays. And so, yeah. But anyway, it's moving along. And I have been in less pain with the last few dental procedures. Maybe pain for like a day with the last 4 on the bottom row. So I only use the ice pack for a day, and I've been, just taking my regular Tylenol every day, which I do anyway for the lupus and fibro and stuff. But with my muscle relaxers and my Savella and everything and gabapentin, I feel pretty fine. I will tell you that I will be getting top to bottom dentures by June, and I'm super excited about it. So hopefully things will move along smoothly with no interruptions. I've been going to dialysis for almost 6 months. I believe maybe March will be 6 months or 5 months. But I was in the hospital in September of last year and started at Fresenius at the end of September. So October, November, December, January, February, March. So 6 months. I literally counted on my fingers there, Gerald. So I will say that Fresenius is still an awesome place to go to. It's almost like you're one big family. Like you kind of listen to the nurses, talk random talking and talk about other people or or parties that they've gone to and what kind of drinks they've had or how their parents are doing, how this patient's doing. Like, you just kind of are a part of it, and it's kind of hard to be avoided because, you're right there during dialysis. It's not very easy to put on headphones and listen to the TV because you're still going to hear the machines and people's cell phones going off. So I'm fortunate enough to be a lip reader, and I could, put the TV on silent and watch my HGTV, which is all the design shows that I love. And I keep my left arm straight now because I'm using a shorter needle. It's still a 4 gauge. I think it's a 4 gauge. I don't think it's 14. I think it's 4. I can't remember, but it's pretty fat and it does hurt when it goes in. And then I bleed a lot afterwards when they take the needle out. So my time starts at 11:20 Monday, Monday, Wednesday, Friday. It's messing with my brain, as you can tell. So Monday, Wednesday, Friday, my chair time's 11:20, and I finish up at 3:20, and I feel like I'm messing up big time. So yeah, 3:20, and then I walk out the door at 3:50, and that is because I take one needle out at a time, and they have to hurry up and put the thick gauze on it because I am a bleeder. And then I put my glove on and I have to hold it for about maybe 5 to 8 minutes. And then we tape it up and then we do the second needle. And then I walk out the door, and my Medicaid taxi is already there to greet me. And it takes about 20 minutes to get home when the weather is nice, 25 minutes when it's a little rainy or snowing out there. The doctor and her nurse show up every other Wednesday. They are contracted through a different hospital, nephrology clinic, and I just love them. They've always been nice to me. They're always saying I'm staying on top of watching my phosphorus below 1.5 milligrams and watching my sodium and potassium below 2.0 milligrams and drinking the right amount of water. And yeah, so I have hopes that, God forbid, I was no longer a candidate on the list for a kidney, that I believe that I can live another 20 years on dialysis. And I say that because I've seen a few people on TikTok that are on dialysis, and they've been going for 22 years. So I'm very optimistic, but as long as I am eating right and doing what I'm supposed to be doing, then kudos to the doctors, right? And for myself. So, but that's pretty much it. There's nothing else going on. I'm still doing my arts and crafts. I'm very tired after dialysis. I will say sometimes there are a lot of symptoms that people go through dialysis where if they're pulling a lot of fluid, which is more aggressive at the end of your third or fourth hour, your blood pressure can drop dramatically, and it makes you feel like you are having a heart attack, makes you feel like you are dying. And that's not an exaggeration. I'm not the only one that's going through that. It's been maybe almost 2 weeks since I've had those symptoms. I should say about a week ago, though, I did throw up in the car on the way home because I had a severe migraine. But at least I had a vomit bag, and the driver pulled over to 7-Eleven and brought me a large bottle of ice water or whatever, bottled water, which I'm not supposed to have, so I gave it to Ryland. But other than that, I think things are going really smoothly. And now, without further ado, Gerald is going to update you with his health of what's going on and how he's been feeling. And you could talk about your arm, you could talk about your stomach, and then there you go.
Okay, hello people. First and foremost, my mental health has been doing really well. Meaning that the medication that I'm on, the two psych medications, they're working wonders for me.
That's great.
It's giving me a better hope of feeling like I do need to be on this earth, basically. And also, I'm doing a lot more things around the house instead of being more like a vegetable on the couch. So recently I had some stomach issues back and forth, and I've been going to a gastroenterologist, and there wasn't really much they could say or do for me. So she suggested to have me go to a specialist for bloating and other things that were going on with my stomach, like nausea. And so when I went to the specialist, she had me do a test, which is called a gastric bypass or a gastric test or gastric emptying test, sorry. And this, you eat a breakfast, which is eggs and toast, and they put something in the eggs, and so they take a shot of your stomach for about a minute, and then you got to wait an hour, do it again, and wait another hour and do it again. So you got to do it up to 5 times for that hour, or every hour. And so I got the results back, and I was diagnosed with a thing called,
I'll hold this for you, and you can read it.
Gastroparesis, which is delayed gastric emptying, which
Looks
means
like it says gastroparesis.
Okay. Mm-hmm. Okay, good. And basically what it is every time I eat food and I swallow it down my throat into my stomach muscles take a lot longer to break the food down. So that's where the bloating comes in. So now I'm on kind of a, well, actually not kind of, I'm on a diet where I have to measure my food out, and I could eat up to probably 4 to 5 times a day throughout the day instead of eating 3 large meals a day. And I also have to drink plenty of water to make sure that everything works well in the stomach as far as breaking down. Also, after I was diagnosed with that, it kind of rocked me a little bit and it kind of shook me up, but I have to keep off my sugar intake. I got to keep off a lot of other things. But hey, eating healthy is not that bad. It saves your life,
And you've been
basically.
measuring like a cup and a half per
Yes.
meal, right?
Yes.
Yeah.
And now onto the shoulder. I've been having shoulder issues probably for the last 6 months. And I had talked to my primary care, and he thought it was the rotator cuff, and I was thinking the same thing. So he wanted to dig more into it to try and figure out what was going on with my shoulder. So they had me do an MRI. So I actually found out that I have a fracture on my shoulder near the humerus bone. And so I went to go see a surgeon about it, and the surgeon says the reason I got it is there was probably a blood loss somewhere in your shoulder, and it started eating away at the tissue and the muscle or whatever. So that's how I ended up with the fracture. So luckily I'm going in for surgery on April 8th to get it repaired, and it's a 15-minute procedure, but 30 minutes overall. So I'm going to be laid up for about anywhere between 3 weeks to a couple of months. But in that healing process, I also want to go through the physical therapy.
Now, explain the process, because it's not an actual surgery that we would think where you're under or partially under and they're cutting your arm open and, fixing the bone. So explain what that procedure is actually going to look like.
So basically what the procedure is, the doctor's going to go into my shoulder and he's going to use like a microscopic like needle, and he's going to place a wire on it, and he's going to send it down my shoulder, and then he's going to shoot me at least 4 times around that area. Then what he's going to do is he's going to take that out, stick the needle in a bone marrow section
Of your back?
of my back or tailbone area. And then after that, then he injects it back into my elbow, and then that's how it kind of like goes from there. It kind of heals on its own process.
Now, is this the elbow that you broke a long time ago or had surgery?
No, it's this one right here.
Oh, it's the other one.
The right
Okay.
one I had tennis elbow.
Okay.
It's from working, doing repetitive up and down with my wrist, and it took a toll on my elbow, and then I ended up with tennis elbow, so I got surgery done on that.
Okay, so this is the left
Yeah.
shoulder that goes kind of down almost to the elbow area.
Almost to the elbow area.
And, I'm encouraging Gerald, as you know, post-stroke, sometimes they tend to forget things. And so I reminded him that anytime you feel pain anywhere in your body, bring it up right away. Tell me about it, and then I can, remind him to encourage him to reach his doctors through my chart and then go from there. That way you're not waiting so long because it could turn something worse.
Yeah.
Let's go back to the stomach thing. Now, Gerald has one more test, I believe, right? And that's in March?
Yes, I got another test where they're going to stick a small tube up my nose, and it's going to go back into my throat. So attached to that tube is sensors, and so for 1 week I'm going to be off my GERD medicine, which helps me with my acid reflux. So I'm going to be basically just
Bloating and hurting.
Well, I'm going to be hurting basically
Yeah.
because I'm going to have all that stomach acid coming up, heartburn, and everything else. So I have to quit that for a week, and then after that, for 24 hours before the surgery, they want me to take myself off the Tums. So I don't know how long the test is going to be, but it's supposed to see how my throat reacts to food going down and how my swallowing process is.
And did you say, I know that's such a long word that you and I were trying to pronounce. Is that something that one of your classmates and somebody that I recognize from Arapahoe High School, we won't say her name, but had that same, is it a disease? Is it an autoimmunity?
It's a disease.
And she passed away.
She was diagnosed with it in her early 20s. And then she passed away in her mid 40s, I believe.
Okay.
And so what happened with her is she basically did everything when she found out in her 20s that she was diagnosed with this. She started eating healthy, eating properly, and everything like that. Her problem is that it got backed up into her bowels where she couldn't move them. So they tried using medication and nothing was helping. So she was going to the bathroom at least anywhere between 3-4 days, even up to a week. And so she got so much blockage from it that she had to keep going back in for like, kind
So
of
she
like,
couldn't go to the bathroom?
no.
Okay.
She had problems. And so what happened is that she would have to go in like, what do you call it? Like a cleaning out of your colon or
It
whatever.
almost sounds like what Heather O'Rourke went through.
Yeah.
And I don't know if it's the same disease, but most of us Gen X would remember little Heather O'Rourke was in the Poltergeist movies.
Yeah.
And she was the blonde. And so when I hear this, Gerald's going to do this other test. We're remaining optimistic and hopeful that, you could ask your doctors during that time or after and say, hey, I had a classmate that was diagnosed with this and she passed away sadly. Am I going to have a good outlook on life? And is it treatable? Is it reversible? Things like that. So
I found out it's treatable. You can have it treated where you could have, a normal life, but it's irreversible.
Okay.
I'm going to have it for
maybe
the rest of my
ask
life.
if it's going to shorten your life, because if she got it in her 20s, she didn't live that long.
Yeah.
I mean, from birth to the 40s, she only lived about 45 years.
Yeah, pretty much.
And
45,
so
46,
sad.
something like that. Yeah.
Probably a little older, because if we went to high school with her
Yeah.
and she was in your class, she would be your age.
No, she graduated a year before me.
Okay.
She graduated.
Did my brother graduate a year before you?
Yeah.
Okay, so
he
Nathan might know her then.
Yeah, he graduated with her and another one that was her best friend.
Okay.
So
I just recall seeing her maybe freshman year, sophomore year, roaming the hallways and maybe some other classes like art or something. So it was very sad and tragic to hear this.
Yes.
So, well, anyway, any other news that you want to share? Like, life is still going pretty good over here
doing
in the
pretty
townhome.
good. Doing my therapy and my psychiatry, and both of them are working wonders. So.
And same here.
Yep.
And Ryland's doing great. He's still working 2 jobs and enjoying life and hanging out with friends. And, he can't afford anything out there in the real world. That's just the way it is with, a lot of kids that are teenagers all the way to their mid-20s right now. It's like trying to decide, do I save up for a car? And then when you get a car, can you afford the license and everything that comes with it and insurance and, or do I get an apartment and a roommate? So, we're just letting him do his thing. And some kids are late bloomers and look at our world right now.
Yeah.
It's scary out there. So
yes, it is.
We're blessed to have him here in the home and we don't stop him and we just tell him, forewarn us if you've got enough money to move out or whatever.
Yeah.
But his medical insurance, you guys, is insane. He doesn't qualify for Medicaid but he does not, make enough to, well, he's barely making enough, I should say, with both jobs to afford his medical insurance, which is costing about $320 a month. It's really ridiculous, but, Anyway, that is it. The animals are doing great, and the sun is shining. It's 65 degrees in Colorado today, and it's going to be in the 60s the rest of the week, and we are loving it. So I hope the rest of you are going to have a short winter, even though it's been a long winter. I hope it's going to start melting and being really sunny and warm for the rest of you. And I hope that you all are staying healthy and positive, and lots of love coming your direction. Thanks for listening, everybody. Peace out and stay positive.
Bye, everybody.
Bye-bye.